Good afternoon. My name is Dr. A of Angels Core Care, and I am a physician who specializes in enhancing your health and wellness through medical weight loss, hormone balancing, body sculpting, and addiction medicine to enrich how you feel about yourself and improve your quality of life. I'd like to welcome you to this program, and if you are here live, please type hi in the comments so that I know that you're here. If you are watching the replay, thank you so much for taking the time to come back and visit us. Please type replay in the comments. In addition, if you have any questions, please feel free to put them in the comments as well, and I will do my best to answer them during the presentation. So, my topic today is a continuation of obesity and medical weight loss. And in my last program, I talked about how in just 7 days, I myself lost 4 pounds, which was very, very exciting. So, how did I do it, and can you do the same? Well, two-thirds of all Americans are overweight or obese, and that means two-thirds of everyone in this country could benefit from medical weight loss. I myself am not obese, but I do have a few pounds of baby fat that I'm still trying to lose after giving birth to my youngest. And so I actually succeeded in losing 4 pounds in just 7 days, and I was very, very excited about that. But then it happened. I had a birthday, and those lost pounds seem to find their way back. And but as I tell my patients, life happens, and so the key to success is how do we deal with that? How do we rebound from that? But because of the accountability, I ended up having a birthday week, not a birthday 2 weeks or a birthday month or a birthday year. I was able to get refocused, and I'm already back on the path to losing weight, and you can be too. So, as I mentioned last time, there's three main tools really with medical weight loss. Tool number one is mindful eating, and that really has to do with being aware of what it is you're putting in your body. During my birthday week, I definitely ate out a lot more than usual, and I'm paying for it. But by being aware of that, first I know what I did, and because of the accountability, I know what I need to do to get back on track. And again, I am. So here in our office, we have three different programs to help with the mindful eating. One is called a low calorie program. And on this program, we greatly reduce a patient's calories, but we give them medical grade meal replacements to consume. That way they don't have to plan as much. The meal replacements are all prepackaged. It tells them how many calories they're getting. And so they don't have to be mindful of other issues. They can just focus on that. And that's often a way to lose weight quickly. We also have a modified version of this where a patient would have three of these meal replacements a day in addition to a regular meal. So we discuss how to prepare that regular meal, things to think about, and they still have the meal replacements as tools to help control their calorie intake. And that's what I personally am on, where I have three meal replacements a day and a regular meal. We also have a balanced deficit program where there's no meal replacements and patients are on exclusively regular food, though sometimes they still want to get the meal replacements a la carte because they're pretty good. But we talk about how many calories you want to prescribe for them. We talk about how to prepare their food, how to measure their food, and again, help them to be mindful of what they're eating so that they're in more control of their dietary habits. So, tool number one being mindful eating. And then tool number two are medications and supplements. There are many anti-obesity medications out there that help with appetite. However, some are available only to people who are obese or people who are pre-obese with certain medical conditions. However, here at the office, we recently launched a weight management medication protocol that even pre-obese patients are able to take advantage of. And I have joined that, and I've added this to my personal treatment plan. There are also supplements out there designed to combat the slower metabolism or the increased hunger hormone or the decreases in fullness hormones, which help burn fat for energy and also help with appetite management. And I am taking some of these supplements as well. Tool number three is accountability, and that is really having somebody walk with you on this journey and help you stay on track. And again, as I temporarily got derailed because of a birthday, because of the accountability, I was quickly able to get back on track. So again, it was a birthday week rather than a birthday 2 weeks or a birthday month. So, thus, with me being on a modified low calorie program, certain anti obesity medications, and certain supplements, I was able to lose 4 pounds in just 7 days. And with the accountability, I'm back on the path to getting it back off and keeping it off despite that birthday week. So the good news is that all three of these tools are available in my office. As I said, we offer meal replacements and meal plans to help with the mindful eating and to help reach your caloric intake goals. We also offer anti-obesity medications in addition to supplements, again, to help your body fight the weight loss journey with you. And we offer accountability, which is very, very important. We can actually do weekly telemedicine visits where we touch base with patients, make sure they're doing what they need to do, offer counseling. And so we fight hard with you, not only to lose the weight, but to also keep it off. So, if today's presentation, if this information was helpful for you, whether you have obesity, pre obesity, or not, or if you learned something new, please type helpful in the comments. And then also, please be sure to share this video because, again, 2/3 of Americans are overweight or obese. And so, we are trying to help those Americans improve their health. So, if you or someone you know has obesity or pre obesity, we are here to help, and we want to help by offering treatment that works. Please give us a call at 614-442-2600 or visit our website specifically designed for medical weight loss. And that website is weightloss.prohealthservices.org. So imagine if we worked together and how much better you would feel if you were able to decrease or eliminate certain medications, if you were able to improve your activity levels so you can go playing with the grandkids or go play kickball with the neighborhood kids or have an improved energy level, or if you could reduce certain medical conditions or reduce the risk of them, such as high blood pressure, high cholesterol, or simply how much better you'd feel if you could look in the mirror and have a bigger smile because you feel good about what you're doing. We would love to help you get there. And again, our telephone number is 614-442-2600. Thank you so much for joining me this afternoon, and I will be back next Thursday at 12:30 p.m. Eastern Standard Time. Hope to see you then.